Hello all, this is Dr. Dheeraj Masapu, and in this video what I am going to cover is why surgery is a business. So if you are thinking that I'll talk negative about the healthcare industry, then you are mistaken. You can watch someone else's YouTube videos. You're doing that. So being a surgeon is slightly different from other specialties. That is what I would like to cover in this particular video. For example, if you take physicians, anesthesiologists, pathologists, microbiologists, ER, I don't think you will fit the model of entrepreneurship, because even though you're solving problems of the people, which entrepreneur does, entrepreneur will always have a product at the end of it to give to that particular person from whom he is solving the problem. But this actually the surgical specialties and also the interventional cardiology, interventional radiology, and all the interventional specialties have a product at the end of it. So that is the procedure that they're doing. Okay, so let me explain you. So what entrepreneur does is, entrepreneurs will solve the problems. At the end of the problems, they will deliver a product to the particular person. So this model only surgical specialties are fitting. So this video is to guide my followers in surgery in this particular channel in how to actually build an entrepreneur kind of a model, because that is the only model which will work out for surgery, not actually moving abroad, not actually going to medical college, not going to some institute. So let me tell you first entrepreneur's journey, and then I'll relate that to surgical specialties and tell you. Entrepreneur will first learn a skill, he will master it, he will tell the world that he or his company is the only area where this problem can be solved, or at least in that area. Then he'll market his skills, he will hire a team, and then he'll have leadership skills, and he'll solve a problem of a person who's coming to him with a product that his company is delivering. Let us keep surgeon in this place, then you'll understand what you should do. So first, as a surgeon, you have to get trained in the best branded places in India or world, and then your skill should be unique. Not everyone should know how to operate that particular procedure, which is very difficult to do, I know. If you want to know some niche areas, you can watch one of my videos, Why Surgery is Dying. In that, I did research and explained what are the surgical fields actually are niched out and having demand. Okay. Second thing that he should do is he should have a team of anesthetists or diagnostic procedures or a small hospital. Something should be there. Okay. And he should be the leader. And third, he should have a very strong marketing strategy. It can be offline, online, or anything. In the modern world, I think digital with AI would help more than the offline, because most of the people are searching in Google nowadays. But word of mouth is a very strong marketing strategy. So initially you can attract people through offline, online, both, but later on, after few decades, what will happen is word of mouth only will work out. Okay, so and then at the end of it, a product is a surgery. Okay, the surgery that he is doing on the particular patient, not for his benefit but for the benefit of the patient only. So he is doing the surgery and he would be charging some X amount. So to do this, the skills that a surgeon should acquire is the unique skill, the surgical skill, the marketing skill, the leadership skill, and also you should also understand a little bit about the equipment and maintenance and all that. So if you know all these things, the rewards that the surgeon gets is exponentially higher than other specialties. If he doesn't understand this core principle, then he will earn like any other specialist. So if you are my follower and if you want to take up surgery, then please understand that it's a big journey, it's a decadal journey. You have to follow these footsteps and then you will achieve. So what I explained to you in this particular video is called strategy. So this is a strategy that you should have at the beginning of your career, at least a vague strategy, and then you should follow the footsteps, and at the end of it you will actually reach a position where you are like an entrepreneur and you have a product, you have a team, you have a strong marketing strategy. Okay, and in a legal way, in a very, very legal, according to NMC norms, you can earn a very, very, very huge amount of money and nobody is going to question you, and it will be white money. Okay, so that is what I can tell for intervention based specialties. Okay, so if you really want to talk to me and understand more in detail of all these things, there is a link in the description where I'll explain You can sit one-on-one with me, but not immediately. There is some waiting period because many people are showing interest. So, and I'm not, and this is not my business, okay? So I'm a full-fledged senior consultant. So that is my main profession. So in between, I love actually guiding and mentoring juniors. For that purpose, I'm doing all these things. Okay, so I will sit with you. Anyway, this is not an emergency. So in a month's time, if you enroll, I can sit with you. We'll get in contact with you, and you can discuss with me one-on-one and how to make a strong strategy. Okay, so thank you guys. Hope you guys like this. And surgery is not a business, but a surgeon should have an entrepreneurial mindset. That is a message I would like to give. For thank you. So these videos are only for doctors and people who love medicine. Okay, so if you are such kind of person, this kind of videos would actually excite you. If you are looking at some video which will talk anti about doctors, there are so many YouTubers who just do those videos for the views, actually not for anything else. Because if somebody is talking about doctors or anti about doctors, a lot of people would be interested in seeing that. So that is the thing. Okay guys, thank you very much. Thank you for following the video till the end. Roger that.